I'm Julie Pompougnac. I'm a psychologist at the Reference Center for Cardiac Amyloidosis, co-coordinators of the Amyloidosis Patients Education Program related to our subject. I'm also a shiatsu massage practitioner. I'm going to tell you about the complementary approaches we've been able to put in place at the Reference Center to improve the quality of life of amyloidosis patients and their caregivers. On these magnificent care trees created by Agathe Rowell, who has lent her artistic touch to many of our projects, here are the members of our team who contribute daily to improving the quality of life of our patients. Isabel and Carol, Isabel is here, the Reference Center's receptionists, secretaries, and coordinators are on the front line when it comes to improving patients' quality of life. They welcome patients, listen to their needs, and based on this, direct them to the various medical or paramedical professionals. They are the first line of support and help in the search for solutions to improve symptoms and daily life, and remain a point of reference and a resource for patients through their treatment. Stephen coordinates patient care, working with hospitalized patients. He monitors the progression of their symptoms and the continuation of their treatment in a day hospitalization, consultation, or remotely when they return home. He helps to improve management and communication between the various medical and paramedical staff, as well as with the family. The social worker, as an important member of the multidisciplinary teams, is attentive to the needs of patients and their families, whether in hospitalization or in consultation, and assists them with the social procedures for access to care, orientation, and return home. She helps them make the necessary adaptation to improve their quality of life. Whether during hospitalization, in consultation, or over the phone, I offer patients and their caregivers attentive listening and psychological support. This support is particularly important when amyloidosis is diagnosed, treatment is initiated, the disease progresses, or when life change occur. Together with the multidisciplinary teams, I support relatives of people with amyloidosis at every stage of presymptomatic amyloidosis diagnosis and genetic counseling. Je sais pas comment faire du coup pour mettre le film en route. Non, la dia, voilà, là, je dois. Non, avant, il faut que je. D'habitude, voilà, merci. Aesop is an étoile. She awakens the life in everyone and distills happiness. The étoiles are treasure hunter, hospital respirator, and peace blower. Aesop offers hospitalized patients a different perspective on their illness through light-hearted weekly meetings. We can't change life, but we can change the way we look at it. During her visit to the wards, she also offers these breathing moments to the nursing staff. As a member of the French Association Against Amyloidosis and a resource caregiver, Jean-François supports patients' loved ones. With me, he co-leads the Living with Amyloidosis on a daily basis workshop and self-expression group for caregivers. This is our therapeutic education program, an approach whose objectives will be presented to you in one of the following presentations. Except for the patient's expression group, the various workshops are all open to caregivers who are invited to participate with or without their loved ones. Among the therapeutic education workshops offered to patients and caregivers, 2 workshops are designed to enable participants to learn simple, easily reproducible techniques for taking care of themselves and better managing pain and stress. Self-hypnosis, a key resource for the patients, doing self-massage for everyone. Donc là, il faut mettre le film en route, je ne sais pas comment. Merci. Karen is a nurse trained in hypnosis, analgesia, and therapeutic education. She proposes to the patients and caregivers to learn simple self-hypnosis techniques to relieve illness-related pain, fatigue, stress, insomnia. It's a moment of relaxation shared with other patients or caregivers, which helps to achieve a modified state of consciousness. It begins with a discussion in which participants are invited to share their expectation regarding the objective of this workshop. Karen then invites them to discover and take ownership of a self-hypnosis technique adapted to their needs. After the workshop, she emails participants the audio recording of the session so that they can use the technique on a daily basis. C'est pareil, il y a un film aussi. I'm a psychologist trained in therapeutic education and doing a Japanese self-massage technique derived from shiatsu, which we'll be talking about next. In Japanese, doin literally means the way of energy and provides a sense of well-being. It enables participants to reclaim their own body and help to manage stress and pain. The self-massage session follows a whole-body protocol that begins with a moment of centering, breathing, or exploring perception of one's own body. The participant is then invited to engage in self-massage, hand or finger pressure, percussion, massage, and stretching. They also learn to locate and apply acupressure points chosen to relieve the problem identified at the beginning of the workshop. At the end of the workshop, patients receive an illustrated booklet describing the doing techniques they have learned so they can practice them on a daily basis. Encore un film. This year begins the study Amylo-Shiatsu Acute Chronic, Effect of Shiatsu on Symptom and Quality of Life of Amyloidosis Patients, which aims to integrate Shiatsu targeted at the symptom of amyloidosis as a complementary therapy to improve their quality of life and their symptoms: appetite, nausea, digestive problems, sleep, fatigue, anxiety, depression, pain, and to rebalance the autonomic nervous system, which has been weakened by the progression of the disease and hospitalization. These images were filmed during the training of the shiatsu session that will be given to patients taking part in the study. Shiatsu is a manual approach of Japanese origin involving finger and palm pressure, mobilization, and stretching applied to the whole body. It has an osteotendinomuscular action, a global physiological action, and an energetic action through specific work on meridians and acupuncture points. Support for carers, psychological support, and art therapy and shiatsu improves their quality of life at work, reduces stress and physical strain, improves alertness and cognitive performance, and helps them to care for patients. These shiatsu for carers and art therapy sessions provide a shared space for relaxation, well-being, and reappropriation of one's own body. They encourage the development of relationships in a climate of trust and kindness, in a space different from that care, while improving the care relationships. Merci. Thank you. Gracias.
Okay, thank you.